and welcome to the Healthbeat Show. You can tell I'm Dr. Jeffrey Watson under this mask, but we are in a surge time of COVID-19 right now. I'm Dr. Jeffrey Watson. Welcome to the Healthbeat Show. Today, we have a wonderful show for you. What's today's show going to be about? It's going to be about the vaccine. Are you going to take the vaccine? Joining me is none other than a wonderful top specialist in the area of infectious disease. This is Dr. Mark Finch. Dr. Mark Finch is an infectious disease expert. He's an African American, and you don't see too many infectious disease experts that are African Americans. And let me just give a little bit of introduction about Dr. Mark Finch. Dr. Mark Finch has a degree from the University of California at San Francisco. He currently works with Diablo Infectious Disease right here in the Bay Area, working at several different hospitals. He has a clinic that he works with. And he trained, as I said, at UC San Francisco, went into private practice, and eventually became a medical director for an insurance group. He has worked with Alameda County prior to 1989, worked at the Center for Disease Control, eventually worked internationally in Lima, Peru. He is an author of many, many articles and a member of the Society of Hospital Epidemiology. That means the study of the causes of disease and the transmission of disease and these types of things. Dr. Finch has authored over a dozen articles in peer-reviewed journals and has presented at regional and national conferences on various related healthcare subjects. He and I have worked in the community together, and I'm very honored that he's finally here, right here on the Healthbeat Show. Welcome to the Healthbeat Show, Dr. Finch.
It's my pleasure, Dr. Watson.
We're so honored that you would be here on the verge of the time that the vaccine for the coronavirus is about to come out, okay? I want you all to stay tuned. This is going to be a very, very important one. We'll be right back. I'm Dr. Jeffrey Watson. For more information, go to our website, healthbeattv.info. You'll hear more about the information that we're giving you on the Healthbeat Show. We're with Dr. Mark Finch, infectious disease specialist, right here in the East Bay. Dr. Finch has worked for the Center for Disease Control. He currently works at several hospitals in the East Bay, St. Rose, Kindred Hospital, has a clinic. And Dr. Finch, you are right now in the middle of this coronavirus surge and people getting sick. It's tripled in just a few months. How are you seeing that this can be handled in this community right now?
Well, you're right about that. And by the way, thank you, Dr. Watson, for having me on your show today. But you are absolutely right. We are in the middle of a surge, which is unlike even the first surge we had back in the late winter and early spring of this year. And I know that for a fact, not only based on the reports coming out of the Alameda County and the state health departments, but also from the hospitals that I work at and that my other colleagues in the infectious disease group work at. For instance, at St. Rose Hospital, which Dr. Watson also works there on occasion, our ICU is completely full. It's a 10-bed ICU, it's completely full. I'd say about 8 of those 10 patients are COVID-19 patients. And then we have a floor called the 5th floor, which has probably another dozen or so COVID-19 patients. One of my colleagues who works at Washington Hospital told me this morning that he thinks there are anywhere from 30 to 40 COVID-19 patients either diagnosed or suspected at Washington Hospital as we speak. And the same can be said probably for other major hospitals in this area. So we are in the midst of a tremendous surge of cases. in the Bay Area, in California, and in the United States.
You know, Dr. Finch, the Healthbeat show used to be a call-in show where people from the community could call in and they could ask questions. And I am just flooded with questions from patients, from other colleagues, from people everywhere I go to. I went in the bank, the person who works at the bank asked me questions. So I want to ask you some questions from the types of questions that the patients ask me, okay? And I don't want them to sound ridiculous. I don't think the patients are crazy or the people from the community are crazy. But because of our political time that we're in, because what has happened to minorities, and again, this is very purposeful that you know that Dr. Mark Finch is African American descent. This is rare to see this, and I want him to give us his perspective as an African American infectious disease specialist. First of all, what is the coronavirus anyway, and how is it different from the flu? I thought this was just going to be the flu. We're going to get it. It's going to go away. Not that many people are going to be sick, but so many people are dying. What makes it so different?
Well, that's a very good question, Dr. Watson. There's a number of factors that make this both different and somewhat similar to the flu. So let me talk about first what is coronavirus. The word corona means crown, just like the same word as for the beer, the Corona beer. It means crown. And that name derives from the way the virus looks under microscope. If you look at take an electronic microscope and look at the virus, you can actually see spikes that look like a crown. It's a virus that really is a family of viruses that have been with us before, but not this particular strain or this particular species of virus. Coronaviruses of the types that have been with us for many years cause the typical cold symptoms that many of us, all of us, end up getting at some point in our lives. However, there is a few strains of coronaviruses, and they have generally emanated from the Far East, China in particular, that come from an animal source. Wild animals, probably starts with bats and then probably ends up in other animals that then come in contact with humans. And because of some of the cultural aspects of eating or butchering live animals that are often from the wild in certain parts of China and other Far Eastern countries, this is where this particular virus originated. It came from animal kingdom, exposed to humans. Humans then started transmitting it. Now, why hasn't this happened before? Well, the virus, during its travels from animals to humans, sometimes undergoes genetic changes. And it appears that this virus adapted itself to humans to the point where it became highly transmissible, highly invasive, and in some cases lethal.
There's some thought, there's some concern by many people, and I've seen stories about this on the news. Is it man-made? Was it developed in a lab? Was it mutated in a lab? Was it brought into the community for population control? Or I don't know that you know the answer to that, but what's your thought about it?
That's another excellent question. We can't say for 100% for sure that it could have escaped from a lab that was studying these viruses, because there are labs in China and in the United States, by the way, that study these viruses for good reasons, because they want to understand how they work and understand what we can do to combat them. But I don't think that's what happened here, and I think the vast majority of experts also debunked that theory that it escaped from a lab. And the reason why we know that is that we know that when we look at animals like bats and other animals that can carry these viruses, the civet cat, which is an animal that is often captured and used in live animal markets, the armadillo, for instance, we know that these animals do pick up the virus, and that when we isolate it from the animals, it's very similar to the virus that we now see in humans. And so there's a pretty well documented chain of events that show that it starts out in the animal kingdom, and then through various species of animals, eventually gets to the humans that come in contact with it. So no, I don't think this was a laboratory escaped virus. I think it's like many viruses that we experience in our lives. It has to do with viruses that mutate and figure out a way to then infect humans, which is, by the way, sort of what influenza does too. Influenza comes from birds and swine. So you hear about the swine flu, you hear about avian flu. Those are the two main species that actually carry the influenza. And that's how influenza gets into our population. It starts out in the animal kingdom, and then through some series of events, could be over years, it then adapts, mutates, because viruses do mutate. And when the right mutation happens, it suddenly becomes adapted to humans. And then if it mutates some more, then it becomes more transmissible, which allows it to then propagate through human populations.
Well, now that's an interesting perspective. I hadn't quite thought of it being brought in. Of course, I've heard that the coronavirus may have come in through animals and then ingestion and things like that. But as I think about the flu, I don't necessarily think about birds and other animals bringing it in, but I guess that's how the names came about, and is that may have been the case. Now, are there any treatments that work? We had the hydroxychloroquine or Plaquenil, and some anecdotal stories were that in China, when this disease started, that those people who were suffering from systemic lupus erythematosus and were taking this medication called hydroxychloroquine didn't seem to get as sick. Is there anything to that medicine? In your experience, have you seen it really help or prevent spread of the COVID-19 infections as we see them?
Another very good question, Dr. Watson. And you're absolutely right. In the beginning of this epidemic, and we've learned a lot since the beginning of this epidemic, Dr. Watson knows because he takes care of these patients as well, that we thought, many people thought that hydroxychloroquine might be effective because they had tried it out in cell cultures, that is in what we call in vitro experiments, not in vivo. Mm-hmm. Mm-hmm. Actually, they had tried out in a previous coronavirus called SARS-1, which was another very lethal virus that emanated from China back in around 2003. And it seemed to work in cell cultures. And they thought they might even try it out on patients there, but the SARS-1 virus never actually got going. It sort of died out on its own, so it never really got beyond a handful of countries and was contained. That was SARS-1. Mm-hmm. Now, fast forward to today, we have a similar virus. It's also coronavirus. We call it COVID-19. It's also called SARS-2. That's the other name for it. Mm-hmm. And the reason why we call it SARS-2 and then it's SARS-2 COVID is because it's very similar to the SARS-1 that happened in 2003, coming from China, also from animal markets like this one. But the one in 2003 petered out because it probably didn't have the same level of transmissibility, because transmissibility has to do with the ability of the virus to survive in droplets and in air, on surfaces, etc. And that's often a genetically programmed feature. And so the SARS-1, for whatever reason, wasn't as transmissible. It was probably more adapted to animals than to humans. This one, SARS-2, or COVID-19 is what we also call it, has adapted to humans, has become very highly transmissible. And because no one has ever we as humans have not experienced this virus, it hasn't entered our body until this year, we have no immunity to it. And when you have no immunity to a virus, generally speaking, the virus wreaks havoc because your body takes time before it mounts an immune response. And during that time, the virus is infecting cells, is then replicating in cells to huge numbers, and then those cells die. And those cells could be in your nose, could be in your mouth, your throat, your lungs, it can be in your GI tract, and it can even be in other organs of your body. And then eventually your body mounts an immune response and kills off the vaccine, and your body gets better. But in some individuals, unfortunately, their immune system doesn't come to the rescue fast enough before the virus has done so much havoc, that's done so much damage to their organs and to their lungs that they can no longer breathe on their own, and they all sometimes succumb to the illness. They die.
And so we're talking about the COVID-19. The disease causes a variety of symptoms, many of which, as you said, is a lung disorder. And some of these things are related to the immune system, which you're talking about, the body's own defense system. Okay? We are here with Dr. Mark Finch. Dr. Mark Finch is an expert in the area of infectious disease. We're talking about the COVID-19 infection. Stay tuned. We're going to be talking about the vaccine. Are you going to take it? We'll be right back.
With COVID-19 contributing to more sickness and death across our nation, America's physicians have 3 simple steps you can take to stop the spread. First, wash your hands. Second, stay at least 6 feet from others. And third, mask up. At the American Medical Association, we know that following the science and evidence will protect you and your loved ones. With science, we will defeat COVID-19 together.
We're right back here on the Healthbeat Show. I'm Dr. Jeffrey Watson. I'm joined here today with Dr. Mark Finch. Dr. Mark Finch is a renowned expert in the area of infectious disease. He's an African-American infectious disease specialist right here in the East Bay. He is taking care of, unfortunately, lots of patients with the COVID-19 infection in the hospital, in the office. We have worked together on many of these patients. The immune system, that's our body's own natural defense. There are cells that you talked about a little bit earlier that have not been exposed to this virus. They don't have a memory, having seen it before, because we've never seen it before. So we don't have the cells that are the Pac-Men that fight this infection. Are there any things that we could do? You know, people have a lot of questions. I'm taking herbs, I'm taking vitamins, my blood type, the way that I eat, my exercise, these kinds of things. Are there any things that we could do that would pump up our immune system that might help us to fight this virus before we have to start taking any pharmaceutical medications?
Well, that's an excellent question. You know, the way this virus really does its damage, it does its damage on people whose body, for a variety of reasons, because of some behavioral things that people do, like smoke, or people, and there are many of us who have this issue, is people who gain a lot of weight. Putting on a lot of weight actually suppresses your immune system. Smoking damages your lungs and then makes your lung more susceptible to infections of all kinds. And then people with diabetes, which, by the way, diabetes is also related to being overweight. Those are all sort of modifiable factors, risk factors that we can all do in our personal lives. Control our weight, try to not smoke. Smoking is just a very damaging thing to do to your body beyond coronavirus. Drink in moderation if you drink at all, and exercise, lead a healthy life, and eat well-balanced meals with lots of vegetables and fruits.
So here's the main question before we check out, and I knew this was going to end up being 2 shows because this information is so important. How do vaccines work? I mean, you go, you get a shot. You get a shot in the arm, and then theoretically you're immune. How does the vaccine work?
Yeah, that's another great question. And not only is it a great question because it does kind of really go to the heart of the matter, but also for Afro-Americans, we should not be distrusting the medical system, because people of African descent have contributed to modern medicine in ways that we don't even, many of us, I happen to know because I study it, but many people don't even realize. The first vaccine for smallpox in the United States was actually proposed by an African slave. This was in 1720s. An African slave named Onesimus told his owner, Cotton Mather, who was a Puritan minister, sort of quasi-physician, quasi-scientist. There was a smallpox epidemic in Pennsylvania and Boston at the time. This was in Boston. And he taught his white owner the technique of what we call inoculation. With what you would do is you would take a smallpox patient, you would take a little scratch of one of his little blisters, because people with smallpox get blisters, kind of like what you see with the chicken pox. They get a rash. You scratch it with a pin. Then you go to a healthy person, and you just scratch a little bit of that on their skin, just a little bit, just to give them a small dose. Now that person you scratched has a live virus in him, but it's in such a small dose that his body can pretty much contain it and also at the same time develop immunity. So those people who got the little scratch would develop immunity without getting deathly ill. Because smallpox is a very lethal disease. I mean, half the people or more die. It wiped out millions of people in Europe in the medieval times. And in more modern times, it even wiped out hundreds of thousands of people. It was a feared disease. Now we don't worry about it because it's basically eradicated. But an African slave taught, and this is around the early 18th century, taught his white owner how to do inoculations. So how does that apply to today? So the viruses today, we don't do quite what Onesimus, the African slave, did. We don't scratch people's pustules and then put it to somebody else's skin. But we do something pretty much practically the same thing, but in a less sort of kind of a
less invasive,
obvious practical way. But we instead take those viruses and we figure out what part of the virus causes the best immunity, what protein. And because of modern technology, we can isolate that particular part of the virus, either produce it in cell cultures or in other animals, and then give it to humans, that particular antigen. We give it to other humans as a vaccine without it being a live virus. That's one way. That's kind of like what's been traditionally done with influenza and others. We produce influenza in cell cultures in large amounts, or sometimes in bacterial cultures, because bacteria can be taught to produce proteins from viruses. We then harvest those proteins and we inject it. That's how the flu vaccine works. And then your body sees that protein, which it thinks is a virus. It creates immunity, but it's not the virus. It's just the protein. So it can't make you really sick. It might give you a sore arm, but it's not going to make you really sick. And then you certainly are not going to kick the bucket. You're not going to die because of it. So that's how we do vaccines. Now, what happened with the coronavirus? Because of the impact of the coronavirus on a global basis, we, as a community of scientists, decided we needed to do something beyond the traditional ways of producing vaccines. The traditional ways, which I just described, takes years to develop, 3-4 years. Instead, they went to a new technology that's been recently developed. It actually was developed for the SARS-1 virus, but it never was used because SARS-1 petered out in 2003, 2004, and so they never had a chance to use it. They used what they called molecular biology technology to basically create a fragment of what they call RNA. That it's only a fragment, so it's not the entire RNA. It's not even viable. It's just some chemicals that, not even chemicals, they're biologicals, that if you inject it in an animal, which they did, and now in humans, it actually causes the body to then produce proteins from that little fragment of what we call RNA. And so your body actually produces the protein that the virus normally instructs it to do. But these proteins are not viable. They're not viable virus particles. In fact, this RNA deteriorates quickly in the body. But what happens is your body then produces antibodies. And that's the reason why we've developed these vaccines so quickly, is that we use a different technology platform that doesn't require harvesting protein through animal cell cultures. That's the reason why. In fact, what we do is we use our own body to produce the proteins, and then that stimulates the immune response that then allows you to be protected from the serious consequences of the disease and ultimately the disease as well as death from the disease.
Okay, we are here with Dr. Mark Finch. Dr. Mark Finch is a specialist in the area of infectious disease. He has worked with the Center for Disease Control. He's worked internationally. He has published numerous articles, and he's right here in the East Bay, African American, and takes care of our folks. Dr. Finch, we appreciate you being here. We want the folks to listen to part 2 because you've given us some understanding of what a vaccine is, of what the coronavirus is, are there any treatments, all these types of things. But we want to come back. We want you to watch part 2 because now we're going to be talking about, is this vaccine for you? Okay? I'm Dr. Jeffrey Watson. Thanks for watching us right here on the Healthbeat Show. Join us. We've got some good ones for you. Remember always that your health is your wealth, and when you have your health, you have everything. We'll see you next time. I'm Dr. Jeffrey Watson. Thanks for being with us on this episode of the Healthbeat Show, where we try to educate you about different aspects of healthcare, about eating right, exercising right, what you can do to help yourself, how to access the healthcare system, what kind of questions to ask, what you should do for any particular disease state. Because I always believe that your health is your wealth, and when you have your health, you have everything. I'm Dr. Jeffrey Watson. We'll see you next time.
You don't have to take my word, but I heard if you have your health, you have everything. Take my word, but I heard about the health beat. You're good.